Hello and welcome back to Path to Nursing. Are you preparing for the NCLEX-RN? You're in the right place. In today's video, we'll cover 10 original NCLEX-style obstetrics practice questions on preeclampsia and eclampsia, one of the most important and frequently tested topics on the NCLEX. Read each question carefully, pause the video if you need more time, choose your best answer and then stay for the detailed rationale to strengthen your clinical judgment. Question 11. A nurse is caring for a client receiving magnesium sulfate. Which medication should be readily available at the bedside? A. Oxytocin. B. Calcium gluconate. C. Terbutaline. D. Methylergonavine. Correct answer, B. Calcium gluconate. Rationale: calcium gluconate is the antidote for magnesium sulfate toxicity and should always be readily available. Question 12. Which assessment finding is an early sign of magnesium sulfate toxicity? A. Hyperactive deep tendon reflexes. B. Absent deep tendon reflexes. C. Blood pressure of 140/90 mmHg. D. Increased urine output. Correct answer, B. Absent deep tendon reflexes. Rationale: loss of deep tendon reflexes is one of the earliest signs of magnesium toxicity and requires immediate evaluation. Question 13. A pregnant client with preeclampsia reports seeing flashing lights. The nurse recognizes this as A. A normal pregnancy symptom. B. A warning sign of worsening preeclampsia. C. A sign of dehydration. D. A symptom of gestational diabetes. Correct answer, B. A warning sign of worsening preeclampsia. Rationale: visual disturbances such as blurred vision or flashing lights may indicate cerebral irritation and an increased risk of seizures. Question 14. Which nursing intervention is appropriate for a client with severe preeclampsia? A. Encourage frequent ambulation. B. Maintain seizure precautions. C. Limit blood pressure monitoring. D. Encourage a high-sodium diet. Correct answer, B. Maintain seizure precautions. Rationale: clients with severe preeclampsia are at risk for seizures and require seizure precautions. Question 15. Which assessment finding suggests that magnesium sulfate is achieving its desired effect? A. Blood pressure returns to 120/80 mmHg. B. The client remains seizure-free. C. Proteinuria completely resolves. D. Edema disappears. Correct answer, B. The client remains seizure-free. Rationale: magnesium sulfate is given primarily to prevent seizures, not to lower blood pressure. Question 16. A nurse is assessing a client with preeclampsia. Which symptom requires immediate notification of the healthcare provider? A. Mild nausea. B. Right upper quadrant pain. C. Ankle swelling. D. Fatigue. Correct answer, B. Right upper quadrant pain. Rationale: right upper quadrant pain may indicate liver involvement or HELLP syndrome and requires prompt evaluation. Question 17. Which fetal assessment finding may occur with severe preeclampsia? A. Fetal growth restriction. B. Polyhydramnios. C. Macrosomia. D. Breech presentation. Correct answer, A. Fetal growth restriction. Rationale: reduced placental blood flow can impair fetal growth. Question 18. The nurse should monitor which assessment most closely while a client is receiving magnesium sulfate? A. Respiratory rate. B. Skin color. C. Oral temperature. D. Pupil size. Correct answer, A. Respiratory rate. Rationale: respiratory depression is a serious complication of magnesium sulfate therapy. Question 19. Which blood pressure reading meets the criteria for severe hypertension in pregnancy? A. 138/88 mmHg. B. 142/92 mmHg. C. 160/110 mmHg. D. 148/96 mmHg. Correct answer, C. 160/110 mmHg. Rationale: A blood pressure of 160/110 mmHg or higher is considered severe and requires urgent management. Question 20. A client with eclampsia begins to have a seizure. What is the nurse's priority action? A. Protect the client from injury and maintain the airway. B. Insert a tongue blade into the client's mouth. C. Restrain the client's arms and legs. D. Offer oral fluids immediately. Correct answer, A. Protect the client from injury and maintain the airway. Rationale: during a seizure, the nurse should protect the client from injury, maintain a patent airway, and avoid inserting objects into the mouth or restraining the client. Don't forget to like, subscribe, and turn on the notification bell so you never miss a new NCLEX practice session.